Well, the doctor is in, and it's geriatrician, Dr. Chandini Sharma. And today we're talking about one of the biggest threats to the health of a senior, falls.
Yeah. First off, have you voted?
Yes.
Good girl.
Okay, so when it comes to falls and seniors, what is something that they need to look out for?
And as we were talking in the break, you fell not long ago?
Yes, I have fallen.
You have?
Yes.
And it was not a sports-related injury?
Correct.
Or fall?
And is that what happens most of the time with...
No. And did you injure yourself?
When I fell?
Yeah.
No.
Great. And that's what happens with young people. When they fall, they just get up and walk away. And as we add decades to our life, we continue to think that we will have a fall and we will get up and walk away. And as you stated earlier, one of the most important incidents in a human being's life when they turn 65 and older is a fall. Why are we talking about falls in the fall season? It doesn't happen more in the fall season, actually. It happens more in the summer. Why do you think that is? Because more people are walking about.
Right.
One of the most important risks of walking is falling.
Correct.
If you were bedbound, you'll never fall. But you're walking, I mean, a toddler, a baby, doesn't start falling until they become crawling age or something like that. So, falling. Summer activity related to falls. There are some statistics that I want to bring in. From the age of 50, so not even senior yet, 50, my age, 50 to 70, you would lose 30% of your muscle mass if you were not up ahead of the curve and exercising. Not really like running marathons, but just activity and physical therapy and activity focused towards keeping your muscle mass. In other statistics, the leading cause of injury-related death is falls in a senior. So that means it is not just like you fall, get up and walk away. It can be very harmful.
So when it comes to falling, when does a senior know that, you know, I fell, I hurt myself? When do I need professional medical help?
Any fall in our geriatric world, fall is equal to go to the doctor. Fall is a sentinel event. Even if the dog just ran away in front of you or you got stuck in the wire or the rope or the hose, but fall is a sentinel event. Go to the doctor. Fall equal to physical therapy. If you've had a fall, get physical therapy. Physical therapy will then be able to assess, saying, hey, your balance is off, your muscle is down, let's make you exercise, bring you back to the baseline.
And how do you know, and why do you think it's so important when you fall, you know, to seek that additional help? Why?
Because sarcopenia is something that's going to happen. Let me explain what sarcopenia. Decline in the muscle mass of a human body is called sarcopenia. That's going to start off at the age of 50. You will prevent it by working with physical therapy and keeping that muscle mass on. There are other medications that could be causing a fall. There could be other medical conditions that can lead to gait and imbalance, and that could lead to fall. So that's why if you want to prevent a fall in the future, in your 70s, 80s, 90s, 100, you got to start that work early with your physician and other healthcare practitioners at age 50.
Well, thank you, Dr. Sharma. We appreciate you for joining us as always. Now, if you have a question for her, all you have to do is email us. That's noonshow@griffin.news.